Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here's your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Rikki Hooper, Chief Clinical Operations Officer at Four Seasons. Rikki, thank you so much for being with us today.
You're very welcome. I'm happy to be here.
I'm so glad that you are. And before we begin, I'd really like to congratulate you for being named a 2023 Fellow in Palliative Care Nursing. We are so proud of you.
Thanks so much.
Would you be willing to share just a little bit about your background before we delve into understanding palliative care more?
Absolutely. So I have been privileged to work here at Four Seasons for a little over 19 years. Most of that time has been spent as a nurse practitioner within our palliative care program in various settings, including hospitals and the community. I was previously a critical care nurse, and so I got to witness care in a different format, and it really helped shape my career path and my desire to provide better care for people at the end of life.
That's really, really special. And you know, what listeners might not know is about your transition from palliative care to expanding palliative care and into hospice. Anything there that you'd like to share about how palliative and hospice work together?
Yeah, so I think that sometimes people tend to think of palliative care as hospice care, and as we know, it's not. It's very different. And really, my goal in my role as the Chief Clinical Operations Officer is to be able to make that continuum of care much more seamless, to really focus on the transitions and to help guide people in choosing their own path for their own health care.
Today, we will discuss palliative care. The goal is to help individuals understand what it is, the difference it can make, and when to seek palliative care. We understand that palliative care may not be well understood, whether people believe it's the same as hospice care, like you mentioned, or if they have no idea what it is. We're going to bring clarity today. So for our listeners, it's beneficial to know before we even go further that palliative care is not hospice care. Palliative care oftentimes could even be referred to as serious illness care or supportive care. It also is oftentimes for individuals who are facing a serious illness such as cardiovascular disease and cancer. So could you share further about who palliative care may be able to help and what specifically palliative care does?
Certainly. So, most of our patients that we serve with palliative care have not one chronic serious illness, but maybe two or three or even more than that. You mentioned cardiovascular disease and cancer specifically. We also care for a lot of patients with advanced pulmonary disease, with neurological conditions such as Parkinson's disease or dementia. And I think a lot of people don't understand that those conditions progress over time and can often develop symptoms that need assistance in managing. And so that's one of our goals with palliative care, is to really help people live with better quality through managing their symptoms, and also making sure that they really understand their options when it comes to their own health care, that they are in charge of that they can make decisions about path A or path B, that they don't have to do a specific medical intervention if they don't want to. We really want them to make their own informed choices about what's best for them. And then we really want to help people develop kind of an advanced care plan, if you will, and that might be the completion of documents like a living will or a healthcare power of attorney, so that they can determine who might make medical decisions for them if they're unable to make their own, and then also about what medical interventions they might desire. And that involves a lot of conversation. It doesn't necessarily mean that we complete documents. It's really about helping them talk with their family members or friends about the care that they would want and where they want to be cared for.
That's really important that you just added about where they like to be cared for. Could you share further about where palliative care can be provided?
Certainly. So across our service area, we provide care in a lot of different locations. Generally, we refer to that as anywhere that the patient calls home.
Yes.
It may be a temporary home or it may be a more permanent home. So we do provide palliative care in several of our community hospitals across our regions. And then we also see patients in skilled nursing facilities, assisted living facilities, their own home, residential care centers, etc. We have even been able to provide care for individuals who have had to take advantage of maybe a local shelter or something like that.
Thank you for sharing that. I think it's important for listeners to also understand how palliative care team works with a patient's existing team to provide care. Could you take us down that?
Yeah, so really we want to partner with a patient's existing medical providers, and sometimes they have a collection of them. And so we really want to be able to communicate with each of those medical providers to help to determine who's providing what aspect of the care, who's prescribing certain medications. Let's look at those medications and see if there may be some interactions that we could change, that we maybe need to take away some medicines and offer some alternatives in different interventions as we try to manage symptoms more effectively. So it's a lot of communication. We also want to partner with them in discussing specific medical interventions so that we might have a conversation with the person's oncologist about specific cancer treatments so that we can then help to answer any questions that the patient might have. A lot of the medical things that we do these days are certainly quite complicated, and it's a lot for people to understand. And so if we can really be the interpreter for them and to help kind of translate that into some lay language, if you will, I think that has been very effective for people.
Thank you for sharing that. One of the things that I think is so important for our listeners to understand is that our palliative care program at Four Seasons is quite different than many programs that they might think of in palliative care because it's provider-led. Can you explain what that means?
Yeah, so we have a team of individuals or clinicians that help, and so each of our teams, comprises of physicians, physician assistants, nurse practitioners. We do have a registered nurse in each of our regions and a social worker, but the majority of care is provided by our providers, and so most of those are nurse practitioners, and so they will visit somebody in the location that they live, and it's much easier to have some of these difficult conversations in somebody's own home, sitting in their living room where they're feeling more comfortable. A lot of programs are nurse-led or social work-led, and that, although those can be very effective, sometimes that means that the individual is not necessarily able to receive prescriptions from that particular program. And so the nurse may make some recommendations to the patient's primary care provider, for example, and they can choose whether or not to take that recommendation and to act on it. And so that can sometimes be a little challenging or frustrating for our patients. Ours is provider-led, and so we can prescribe medications and help to really make those symptoms more manageable and to improve the quality of life.
Since our palliative care program is provider-led, it makes me think about a question that many may be wondering. How can palliative care help the caregiver and the family?
Yeah, so we do a lot of things for the patient, but we're also having conversations with caregivers and families and giving guidance as to what to expect next in the disease process, particularly when maybe the patient is not decisional, such as in the situation with folks suffering from some form of dementia. And so we're helping guide that caregiver or family member in what resources may be available. We may bring in our social worker to help with that, to provide some counseling, to talk about how to prepare for the next chapter in life, and then even the next chapter and the chapter beyond that.
Thank you for sharing that. I think it's so important that people hear today that palliative care can provide that extra layer of support and, most importantly, that confidence when you're facing really difficult, serious illness. And so confidence is a key word in my mind that I would love for listeners to feel as they hear about this. Now, just a few more questions, but in terms of our pediatric palliative care program, could you share about what's offered, how it can help?
Yeah, so we're very fortunate that we have a number of clinicians who are skilled at being able to provide care for children and their families. And as you might expect, that is a lot more support for the family. We're able to work with our local pediatricians as well as subspecialists in multiple larger hospital systems in providing care for children. And again, helping guide families make decisions that may, help them as they're moving through the journey of the child's illness, and just again providing that additional support, helping to provide documentation and proof that maybe a child needs a particular piece of equipment that we can see when they're in the home that we don't necessarily see when they go to a doctor's office. So it really is a little bit more broad spectrum, and then being available for questions. And so that's one of the other aspects of having a provider-led team, is that we are available 24 hours a day, 7 days a week. We have a provider on call at night and on the weekends to be able to help answer questions, to provide guidance, and to manage symptoms in a better way.
Again, that makes me think of confidence, because it must be such a relieving feeling for that patient, or for, in the case of pediatric patients, that their loved one, their family could call or could reach out and get the help they need when they need it.
Absolutely.
Wow. Thank you so much for sharing that. So if a patient or loved one wants to request palliative care, do they need a referral from their provider? How could they go about accessing care?
Absolutely. So if the person is in a hospital or in a skilled nursing facility, they would need a referral from their medical provider. Otherwise, they could make a self-referral, and they would be able to do that simply by calling Four Seasons or accessing our website. We are responsive to our referrals quite quickly, and generally we're able to see somebody within a week. We like for people to have at least had a conversation with their medical team, and it's really great to be able to get records so that we are more prepared and able to help them in their challenges.
But if they have any questions, or they feel like I'm just not sure what to do first, they could simply reach out.
Absolutely. They could reach out, and one of our care advocates would be able to have a conversation with them and kind of help them determine which program of service at Four Seasons might be most beneficial for them, but certainly can guide them in the direction of palliative care.
Oh, thank you so much, Rikki, for sharing with us your wisdom. And we hope for listeners that if you have any questions, or you would like to learn more about palliative care or any of the rest of Four Seasons services, please visit our website at fourseasonscare.org, or call us today at 1-866-466-9734. Thank you so much for being with us.
Thank you so much for having me.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.